Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome to our weekly show. My name is Abby. I'm your health living NP. How are you guys doing? Hope all is well. Okay, please share the show. Please invite others to join. As you can see, today is our topic is prostate cancer awareness. Okay, so let me just get in there, get my banner together, please. Give me time to join. Share the show for me. Please do that. Okay, this is a very important topic. Alrighty then. So we're talking about prostate cancer awareness. Again, as always, my disclaimer, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay, so let's get right into it. All right, prostate cancer awareness. So let's talk about some facts, okay? According to the American Urological Society, prostate cancer, most diagnosed cancer in men next to skin cancer. Nearly one out of every 8 men in the U.S. will be diagnosed with prostate cancer sometime during their lifetime, and that number drops to 1 in 6 in Black men. Also, Black men are 17 times more likely to be diagnosed with prostate cancer, and they're also like 2 times more likely to die from prostate cancer. There's so many other reasons that lead to that: hereditary, environmental factors, and inadequate access to health care. So there's so many different factors that. Please give me a thumbs up, by the way, okay? And comments. Don't forget to comment. Give me questions and all. I'll get to that, okay? So people might be saying, okay, prostate cancer, we hear all about it and all that. One time I was talking to somebody about it, and it just said, so what's the prostate? And you would think that, a lot of people would know about that, but it's not something that everybody knows. So let's get into it. And plus, this is an educational thing. So I'm going to get into that. So what is the prostate gland and its function to get on your prostate? So let me go in here. I have to get a picture that's, Facebook friendly. Okay. So let me just go in here and get into my coach here. Alrighty. 1 second. I'll go in there and then I'll get to the so. In the meantime, let me see you guys. Oh, good. People giving thumbs up already. So that's good. That's good. That's good. So, okay. So let me just go in here and just show you this here, right? So when you're watching this over, you can just pause and look at that. So this is the prostate gland right here. You see me moving I thought, let me move this thing out of the way here. Okay. Right here. So this is your bladder up here. You see where I'm moving my cursor? It says bladder over here on the outside looking. That'll be the right of your screen. That's where you keep all your urine and all that. Okay. Your prostate gland lies right below that, right below the neck of the bladder there. And then the tube that runs below there, that's also, let me take my banner out of the way here, hide. Okay, so you see that is the bladder right here where your pee is stored and all. Alrighty, this is the prostate gland. It's like a little walnut-sized little thing that's covering the tube. That tube is the one that runs towards the penis, and that's where you pee from, okay? So when you're looking at it again, you can just pause this and look at that. So that's where it is in the body. All right. So for men, of course, for men, it's going to be below the belly area and pelvis area. Okay. So let's get out of this screen here. And I'm going to go right over here for a second. Okay. So my banners, back to that. Take 3 things at once. So the prostate gland, what's the prostate gland? Is function, okay? It's a walnut-sized gland that lies at the neck of the urethra, which is, I told you where the pee comes from, okay? Your bladder there and the tube that goes down to the penis. Viewer discretion is advised. I'm going to be using proper terminology. I'm not using anything vulgar, just proper terminology, okay? And what does it do? It produces fluid, the semen that contains proteins and enzymes that nourishes and protects the sperm from motility, all right, and fertility. So you can live without your prostate. If you were born without it, you can live without it, but at the same time, it also produces sex hormones too that makes you the men who are if you are born as a man from birth, okay? So it produces all that too. So, you can live without it, because some people, you can have it taken out for whatever reason, not for whatever reason, for various reasons, and still be able to live with it. But and it also helps to control your urine flow, because again, like I said, it covers a little tubing that goes down. So when you're peeing, it opens up, and then when you're done peeing, it closes up. Now, because of that, so as you get older, sometimes it gets larger. So it doesn't necessarily mean you have prostate cancer when you do the screening and all. Okay, but I'll be getting to that. Okay, so I was just told that they have myths among Liberians when it comes to prostate cancer. I think I was told that too much sex causes prostate cancer. One reason why men with multiple wives often die from prostate cancer. That's a myth. I never heard of that. I just heard that today. Masturbation causes prostate cancer because you're forcing the sperm to come out unnaturally, and because it overworks the glands, you can get prostate cancer. That's a myth. And also punishment from God for promiscuity among men. That's the myth. I'll just go with that. Okay, so it go into that. So you say, okay, so what are the risk factors for prostate cancer? So we're going to open that up there. So it can factors if the risk of prostate cancer increases as you get older. Okay, so it's just normal for something, you start getting different kind of diseases as you get older. So as you do get older, you have a risk of prostate cancer. It does affect younger men, of course, too. Okay, so some of the reasons would be your age, your risk of prostate cancer increases, your race. I think, like I said, Black men are greater risk of developing prostate cancer, and are also a risk of developing the aggressive form of prostate cancer than other races. Okay, if you guys can hear me out there, please just kind of put a comment in the subject, so I know that you can hear me. All right, and also, it's a family history of prostate cancer. So it's like your brother, your father, uncle, and all that. If there's something going on, yes, they can get prostate cancer. And in many of your family. So usually we start asking those questions when we do the screening and all that. Also, a family member who has the BRCA gene, this BRCA, that's the one if you will be your mother or sister that have the genes, that increases your risk for breast cancer too. So most of cancers are kind of connected in some way. All right, and obesity, the men obese men diagnosed with prostate cancer may be more likely to have the advanced stage that's more difficult to treat. But again, like I said, you can be of any size and all that. And again, you can be of any age. You can be much younger. We had a sportscaster in our area. If you lived in the area, WPVI in the Philadelphia area, we had a sportscaster. He was such a loving guy. Gary Papa, he died from prostate cancer. I was looking at like since 2009. I can't believe it. It just seems like it was just yesterday. Okay, so what are some of the signs and symptoms of prostate cancer? Okay, so needing to urinate more often, especially at night. Now, when you hear this part, this is just the least common symptoms and all, okay? The most scary. So it doesn't mean you have prostate cancer. So don't start saying, oh my God, you could have like inflammation of your prostate gland. It could be some infection going on, urinary tract infection. You could have diabetes and all that too. So don't think that, don't let your mind go directly to prostate cancer, all right? So I'm just giving you some of the symptoms here. Difficulty in starting to urinate or weak stream. Okay, like you haven't different, you have to go to pee and you're staying there for a long time for the pee to come back. Remember, like I told you, the prostate gland is wrapping around a little tube that leads to your penis that you have to pee from. So if it's squeezing it, all right, or if it's too large and squeezing it, you're not going to be able to pee correctly. And when you in the weak stream, when you go to pee, it's supposed to just pour down, like you open the faucet and it's just supposed to pour down. It's not supposed to be drip, 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 or like squeeze into where it's going in two different directions and all. It's just supposed to go down directly into the toilet. All right. So when you start seeing that, start keeping an eye on that. Okay. Don't just panic at the first like couple of times because maybe you didn't drink enough water at the time. So keep an eye on that. Okay. Again, like I said, it could be some other diseases outside of prostate cancer is totally benign. There's something called benign prostate hyperplasia. That's the one where your prostate gland just get really large, all right, and very large, and it causes difficulty peeing. So your doctor may put you on a medication that kind of loosens the muscles and make it easy for you to pee. But of course, when you do go see your doctor, they're going to be doing the testing for that too. Okay. A feeling that your bladder isn't fully empty when you go to pee and all that. Every time you go pee, urinate. I'm sorry, I'm using different words and all. Okay, it doesn't. You pee and you go and sit down, and then you feel like, oh my God, I feel like I have to go pee again, and you get up and go and pee again. Doesn't necessarily mean prostate cancer, but those are some of the symptoms and questions we'll be asking you when you do come and visit. Okay. And again, dribbling after you finish peeing. When you get done peeing and then you're sitting there and it's still coming down, drip, drip, drip. Like, okay, I thought I already peed already. Okay, so just remember now, frequency, difficulty urinating, and then it's like the weak stream going each and every different way, okay? And then the other symptoms, when you really start looking at it now, okay, unexplained weight loss, general loss of appetite, which that can be attributed to other cancers as well, or other things that are going on too. But when you start looking like 3 to 6 months, you won't notice it like maybe the first couple of months or so. You say, wait a second, I mean, okay, yeah, I'm losing weight. Especially if you wanted to lose weight, okay. So you say, okay, I'm losing weight. I'm feeling good about myself, or and all that. But then you start losing more weight, and you're not trying to lose the weight, and nothing else is going in your life. Like you're not going through any kind of serious life issues and things like that, and you see yourself losing weight over it. Or when people start saying things, start saying, well, it's like you look a little slimmer in the face, you look a little, and if you're already a tiny like a slim man, and you find yourself losing a little bit more weight, that's even more scary too. So make sure you bring that to your doctor's attention. Persistent tiredness or weakness, you know yourself. You usually get up and move around and doing things, and then but every day you come home from work, or sometimes you come home, you're tired, you're not doing your things that you usually like to do. You like going out with your friends and family, and you don't see yourself doing that. Even if you're dragging yourself to do it, you're tired when you're there. Okay. Again, difficulty urinating when you try to go urinate, and it's like really hard to come out. Okay. And if you start noticing ding ding ding, if you don't understand anything I said tonight, if you start noticing blood in your urine, all right, or your semen, okay, you're not supposed to be seeing any blood in your urine. So sometimes it may be, again, like I said, it can be like a little bit because maybe you're dehydrated and you don't have enough, maybe you don't have enough fluid in the body. And also when you're peeing, the urine is a little bit more concentrated, and sometimes there can be a little bit of blood from a little bit of trauma. Okay. But when you start seeing that, and you start seeing that over a period of time, and it's not painful, most of the time you used to be, you say, okay, I was bleeding from my penis, or well, when I'm going to go pee, or when I was intimate with my partner, that's when that happened. And they say, wait a second, did you have any pain doing that? No, it's like painless. We call like painless hematuria. Okay. So it was blood in the urine. So you're going to bring that to your doctor's attention, especially when you see that the first couple of times. But when you start seeing that happening more often, and accompanied with all the other symptoms that I've already listed too, okay? Bone pain, when you start having pain in your pelvic area, meaning below your belly button. Okay, some people have the middle belly button, but way below your belt line, where you wear your pants, in that area, right, your groin area, that's your pelvic area there. When you start having pain in that area, that's the sign to start looking. If you didn't already have pain there, or you didn't have any injuries in your back before, okay? You start having some erectile dysfunction when you try to be intimate with your partner, and you're having a difficulty getting aroused and difficulty staying aroused. Again, because remember that gland kind of holds everything there, and it kind of holds the sperm and all that. So that when it starts getting large or something else is going on there, that's a sign. Okay. And also they can not just the pelvic part, but general abdominal discomfort. You having some indigestion, some gas issue, nausea, pressure. When people start pressing that, you start feeling some discomfort, bloating, cramping, low back pain that doesn't go away. You say, okay, I took some medicine, and the first couple of times it may go away, but then it's still there. You can feel the pain is there. Your lower back, you feel the pain is there. You say, there's something going on. I need to go get that checked. Again, outside of it, if you didn't have anything else going on with that, okay? So you go, I will say, like, give it like a couple of weeks or so, but if it's really persistent, it's more painful, everything else, then you can, and also know your family history too. All right. So screening is not, sometimes some of the doctors and the urologists is still a little concerned about that, because they might say, okay, sometimes you screen and you might do biopsy too early, or you screen and all, but most of the two ones that we do is the PSA, your prostate specific antigen test. That's a blood test. Okay. So when we do a blood test, that's to see where the numbers are, the normal numbers and all. So if I can go in here, I'll probably be able to get it. And then that way you can just pause after when you're watching later. So let me see here. I'm trying to get into it, but I can always get to it later, because I just move my things around. So, okay, this is it right here. Okay, so this is the number. So when you can see there from age 40 to 49, where you're supposed to be, 50 to 59, 60 to 69, and 70 plus, those are the numbers, the range you're supposed to be. So median PSA and normal PSA. All right, so they'll look at that. Again, when you're watching this later, you can just pause it and read. All right. Doesn't mean it's like, hellfire true that this is what it is. So don't go there and start saying, oh my goodness, my numbers like a little bit off, and your doctor will look at that, those numbers and everything else that presented with. Okay. And then also your digital rectal exam. It's not all that pleasant, and depends on if you go see your family doctor or you go see the urologist. By that time, when you see the urologist, by that time your family doctor's already sent you there, and they're a little more concerned. And sometimes some people, your family doctor could be a female. You don't want a female putting the finger up inside your rectum. You may not want a male putting the finger inside your rectum, or your female, your doctor may be younger or older, whatever reason, whatever makes you comfortable. The same way with us women, when we go see our GYN, we might say, okay, I don't want a male GYN. This person might say, I don't, yeah. So it's all whatever it is that you have to do to make you comfortable. They might say, okay. And sometimes there are other doctors in the practice that you're more comfortable with. You can go with that one. Okay. There's no judgment here. It's all about making you feel comfortable in your testing. And we don't want you not getting tested because you don't feel comfortable with that particular doctor. Always, it's like literally 5 minutes. Okay. So, you go in there and you bend over. Okay, basically you bend over and your provider doctor puts their finger up in your rectum, and we're supposed to be feeling for the prostate there. Okay, so it's like if it feels like a little bigger and all that too. Remember, it's like a little walnut. So if it feels a little bigger and kind of tense and firm and all, that's when we start getting concerned, and we might say, okay, go see your family doctor, go see your urologist, or you may be always already with your urologist, and urologist will also order some more testing. Okay, that we call imaging, maybe ultrasound and other things like that, and they can progress from there if they need to. Okay, so those are the two major screening tests. And then also, again, we ask your family history and everything else. And then we put it all together, get this picture, and then we go on from there. Okay, so let me get back here to my banner. I don't see any comments yet. Okay, so what are some of the treatments? Again, like I said, don't think that you have prostate cancer simply because, okay, yeah, I saw blood in my stool, or I've been having some problem with erectile dysfunction, and remember now, the erectile dysfunction, if you're having issues with that, your doctor will order some testing first to make sure there's nothing going on with your heart before they order you medication like Cialis and Viagra and all, because we're going to make sure your heart is healthy for sex. You've seen that commercial all over, okay? So, and they'll do other things too. They might send you to cardiologist if there's something, they find something that's more concerning. All right. So we want you to have a healthy sex life, but at the same time, we want to make sure your heart is healthy for that. And we want to make sure that we're not missing anything that's more serious like prostate cancer or something else. All right. So again, like I said, just because I listed those symptoms doesn't mean you may have it. But depends, especially if you have like a first degree relative, like your brother or your uncle or your dad and all that too. Uncle would be like second degree, but it's still kind of close enough. Grandfather, you kind of look at, first and second and all. Okay. So, and also your both sides, your mother or father side. So it's very important that you know your family history. I know, especially in some cultures like ours, we're Liberians, we don't talk that much about different things, and they just say, oh, this person not feeling well, and the person passes away and you don't know it. But if that person's in your family and you share DNA with that person, it's very important that you learn your family history, okay? Mother and father side. All right. So we would go into the treatments here. So depending on the treatment, depending on what it is, if you're diagnosed with prostate cancer, at the time you're diagnosed, okay, the stages 1 to 4, and you based on your history, based on when they do the testing, and they have to do ultrasound and other imagings and all that. Based on that, your doctor will tailor the care towards you. Okay, so they're not going to say, people, oh my God, if I do chemotherapy, if I do this, that's going to lose my ability to be able to be intimate with my partner, and so many things. And your fears, very legitimate. Okay. And sometimes people are like, it affects your manhood, just the way you feel about yourself, it can affect that too. So it's important. But at the time, when you're diagnosed, depending on the stage that you're in, all that, your doctor, there's so many different options that they could go by. Okay. They can do some watchful waiting depending on the stage that you're at, because let's say if you're diagnosed, the first is most of the time is asymptomatic, meaning there are no symptoms. You may not have any of those other things, and just say you go to the doctor office for something else, or you do some other testing, and we see some other labs that are not wrong, but way outside of the normal range, and we may do additional testing, and sometimes it's called incidental findings. We might say, okay, wait a second, we're looking at certain numbers here, and we did some additional testing, and let's ask about your family history. By then, you should already have your family history, but we may be going more in depth into your family history. Okay, so they might say, let's do some watchful waiting, because especially if somebody's much older, like a man who's over like 75, we're not going to go into all chemotherapy, not meaning that you're not, but it's just that because it's so slow growing as you get older. So the doctor might say, let's keep an eye on that for a little bit. And then we'll talk about, talk about your They might do surgery. They might want to take out the prostate. They might take out the prostate. They might take out, then you do chemotherapy where they start giving you some medication to kind of, burn it away, basically. All right. And some radiation. So, but at that time, I don't want to scare you guys because this is just the awareness part of it. But your doctor will tell you the options. And for most of you, especially if you like African Americans and all that, you've had at least one family member who's had prostate cancer or something going on. So it's important that you know about this because, again, like I said, African American men are more likely to get it and die from it. Okay. Sorry, my board's dropping back there. And but everything will be tailored to your care and tailored to your family history and everything like that, looking at your age, looking at kind of work that you do and all, and how they're going to put all that into the treatment. But it's going to be your family doctor working with you. It's going to be the urologist and all that working along with you to take care of all. And again, if there's anything more going on, because again, the low back pain, and if they find anything else that's like traveling up the spine, going up in that, then you're going to be working with other doctors as well. But first, you're going to see your family doctor, and your urologist will be involved in it. But this is mostly about, awareness. So make sure you're looking at when you go to a pee, making sure you say, okay, I'm peeing more often than usual. Maybe I need to drink some water first. Let's start there. Let's drink more water first. Okay. And then look at what you're eating. If it's making you, eating enough, drinking enough water. And outside of, if you don't have any problems with your heart, you shouldn't be drinking excess amount of water, or your kidneys also. Okay. And then, know your family history, have that written somewhere. You're talking to your doctor, you start seeing blood, and don't feel embarrassed and don't feel scared to get the help, because you need the help. The earlier to get it, remember, everything is with cancer, early detection is key. Okay. So when they find it early, you have a higher chance. Prostate cancer is one of those cancers that if it's found early or early enough, you have a higher chance of surviving after treatment and all that. Like a 5-year survival rate is like almost like 95%. Okay. So it's very important that you get checked. All right. So how do you reduce your chances? Let me see if there's any question. I see a comment here. Oh, my cousin's watching. Okay, let me go back here. Okay, so reducing your chances. There's like really no really right way of reducing your chances. It's not one of those cancers where, okay, depending if you've been smoking or doing stuff like that, and you can stop. It's mainly like knowing your history. I mean, getting your yearly checked and all. Of course, you want to especially when you get to like age 40 or so, go to your doctor and start getting your blood work done so they can start trending. Like I say, we're looking at your blood work, we're looking at this and say, let's see what it is. You were at this number last year. Let's see what it is this year. Like your PSA. Most insurance company will pay for a PSA after a certain time yearly, so they can start watching that. If the numbers are a little bit off, they might want to check it again 3 months later or 6 months later. So don't get scared the first time it's enlarged. The number is elevated because remember, as you get older, your PSAs normally will get a little higher. All right. And then we look at that and look at the whole bigger picture again. Eating healthy, of course, maintaining a healthy weight. As with always, with any kind of health issue, quit smoking. If you smoke, do as much as possible. Again, like I always say, 1-800-QUIT now. So do that. And it's also said the American Urological Society Association suggests men ages 45 to 69 with an average risk, meaning that you don't have a family history of it, okay? Because all men are high risk for prostate cancer, but higher risk. Like I always said, we all have risk for certain diseases, but this were a higher risk. So meaning if you have family history of that, mother, father, brother, talk to your doctor about whether prostate cancer testing is right for you. Okay. So you bring yourself, okay, you know what? I don't have anybody, but I'm at this age now. I'm a little concerned. So should I be getting the test done every year? And most times they'll tell you, so that I always talk about sex specific tests and age specific tests. When I mean sex, I mean female or male. All right. And for men with higher risk, meaning again, when you have a brother, or you have a uncle, or your father, and all. For men with higher risk of getting prostate cancer, they should consider talking to doctors early as age 40 to 54. Okay, because right in that range is where you start getting information whether it may start growing early, and if they can get that early and do the testing early, you stand a better chance of higher risk of surviving. Okay, so. If you detect it early, again, like I said, survival risk is very high for prostate cancer. But if it's much later in the sickness, then you start running into all the different different testing that you have to do and different treatments that you have to do. But that still doesn't mean that that's it. Okay. So for more information, you can go on the CDC website. You can go on it's www.auanet.org. All right, put that in the comment section too. At the prostate clinic, you can do that. You can talk to your own doctor. You can go online and look. Again, like I said, when you go in online to look for information, please make sure you're watching and going on places that are reputable. Don't just go with anybody who's just saying that, because again, I read this myth to you and people believe that. Okay, so it's important that you do that. And for women, the men in your lives, your father, your husbands, your brother, and all, please share this show with them. Tell them, I love you. I want to see you healthy. This is just awareness. I know sometimes we don't like to think about certain things because it's like, if I don't think about it, that means it may not happen. There's always a chance it may not happen and all that too, but it's important that you talk about it. Share it with your community groups. If you're in any men's group, like I always said, we talk about so many things, but we don't talk. Sometimes we always shy away from things that are really important. Okay. So I hope this show has helped somebody. Please share, please share, please share. Again, when you like and comment on the show, it puts it in the algorithm and it goes on. Because I was talking about I was using some words in here, so Facebook might say it's a little bit off, a little bit adult oriented. But again, like I said, I'm using proper terminology. So when you're talking to your family, to your friends and family, you can use the same terminology or, But let me see here, and I don't like to make these show long too, so. Cova said, what are the alternative treatments for prostate cancer? Oh, like I said, most of the time they do, depending on where you are when you're diagnosed, and depending on your age, depending on your other risk factors and all that, they might say, okay, let's just watch and wait and see. We'll do additional testing. We'll do more blood work. We'll do more imaging, like your ultrasound. We can do a CAT scan and all that. And you guys can just kind of Google, I said ultrasound and CAT scan. The ultrasound is just to put the gel on you're there and they kind of just move this probe around so they can go in there and see. They go by the ultrasound waves. The CAT scan is this thing where you go into this big, I'll put that in there. Sorry. So they'll go in there and you might say, okay, we'll just keep an eye on it for now. But if you already say, oh my goodness, I've been having a lot of blood in my urine and I'm having severe back pain. And so they might say, okay, let's go, and based on the testing, all right, they might say, okay, let's go ahead. But it's not one of those things where the alternative, you're talking about cancer. If you don't take care of it, it's going to grow. But if you're much older in life, like 80-year-old and 75 and all that, usually after 75, we don't do too much screening unless if we have to. So they'll keep an eye on that. But if you had like a brother that probably passed away from it, or a brother who had aggressive form of it, and all, of course they're gonna say, they don't want to say, let's take the prostate out. You don't need it after a certain time anyway. So let's take it out and go on from there. So you don't have to worry about it. And just in case if they find any other cells in there, they can just kind of clean it out and go on from there. Okay. And then also Bob Dole, he was the vice president one time. I'm trying to remember. Oh my God, it's been so long. He had it. And after that, he was doing the commercial for Viagra. So you might say, oh my goodness, I don't want to be, have erectile dysfunction, but it can help you there. For men, you guys have everything. So, but the best thing is to speak to your doctor. Start speaking to your doctor now about your history, if you have low risk, average risk, and all, and talk to your doctor about it. Okay. So I'll be available in the questions in the comment section for any other questions, and of course all through in the week. So you can always leave the questions there and I answer it. And if you don't want to do it, you can always just inbox me on there and I can answer the questions for you. Okay, only pertaining to that. Please don't ask me anything personal. All right. So I thank you all for watching. For those of you who are watching now, I say thank you very much. For those of you who will be watching later, I say thank you. As always, our weekly show comes on tonight, and then I do Abby's Daily Dose during the week, okay? So thank you all for watching. Thank you all for your love and support. You have a beautiful night, and I'll talk to you guys later. Bye-bye now.